here in New York City, we have a worrisome high rate of sexually transmitted diseases and unintended pregnancies, and that limits the ability to get an education. And so the more people you can get to work together to share their experiences and what has worked and what has not worked will let us make better decisions.
It began with an interest by the mayor of Cleveland in HIV and STDs and how we were educating students in the Cleveland schools. And he asked, what do we have currently? And I said, well, I know there are a few grades that are being covered, but not comprehensively. He said, why not?
I found out I was pregnant with my daughter at my 8th grade graduation. It's very difficult going to school and still being a mother, because once you have a baby, it seems like everybody's faith in you decrease.
This is really about walking the talk. We really look to partner and bring people to the reproductive health and justice movement who would not be traditional partners. We, in our work, are giving other women the tools to help make their families healthier.
You know, the biggest form of flattery in government or public policy, in my opinion, is plagiarism. Taking somebody else's good idea and making it work in your city or town. The National Institute for Reproductive Health has taken that concept to a new level. People's lives play out where they live. They play out in urban centers like New York and Los Angeles and Detroit and other places across the country. So we should, all of us who are leaders or activists or others in urban centers, be working together.
We created the National Institute for Reproductive Health to create bold new strategies, innovations, the kinds of things that we felt other organizations who had specific areas of expertise were not addressing. The value of the Urban Initiative for every urban community is to learn from others' strengths and to actually incorporate new ideas. You know, for the most part, you have great leaders and local legislators and mayors who are actually out there looking for ideas, saying, what can we do? So it's our hope that we can learn from each other.
In the city of Cleveland, we do have, unfortunately, high rates of sexually transmitted infections and teen pregnancy in our community. That's one of the reasons that really led us to coming up with an intervention, a response. Working with the Cleveland schools and the city and the county, we were able to develop a comprehensive kindergarten through 12th grade sex education program. One of the assumptions that people make about this area is that it's going to be a big controversy, that parents will be up in arms, that the community will rise up and have a big problem with it. But one of the things we learned was that it's just not a controversy. We have seen that parents understand the need for this, that teachers understand the need for this. It's really a common sense approach. It's not about a particular ideology, it is what works.
There are very few programs focused on support for pregnant parenting young people. There are enormous amount of funds in the state of Illinois that focus on enabling the young offspring, the early child education, prenatal care, infant care. What happens to the mother? She's sort of left, you know, with nothing. And so because of the grant that we got from the Urban Initiative, we have finally been able to provide support to a young parent, a pregnant youth, to advocate for herself, to demand equal rights in schools, and enable her to finish her education.
ICA and YPA, they've been a big help. They teach us how to deal with just life as a mother. What color is blue? Yeah. My mission is to be a role model and be somebody that someone can talk to and listen and give them advice at the same time. And if that help a person in a situation they're going through, then that's what type of work that I would like to do.
There are immense reproductive health challenges facing urban residents across the country. All the indicators that we look at when we think about reproductive health status are worse in urban areas compared to the national average. So the first thing is there's an actual need. There's serious challenges facing urban communities. And the other side is an opportunity that hadn't really been tapped into.
There's been so many studies and statistics that show that Black women are hardest hit in a variety of different health issue areas. Reproductive justice is a movement that talks about the right of women to be able to have children or not have children, and to raise the children that we do have in healthy communities. So we're really interconnecting the work we're doing here in California with work that's being done in other states. Oftentimes when you work in a community, in a city or a state, it's just really healthy and important to kind of go other places and see how other people are doing the work.
The exciting thing about the Urban Initiative Summits kicked off here in New York City is that they're pulling everyone together in an important way. It's pulling healthcare professionals and public health commissioners, elected officials, and activists all together to share ideas, share information, to share best practices.
What the Urban Initiative does is it gets people from different backgrounds, different experiences, different parts of the country to pull together and let us understand what the real world is about.
I think of the spirit of this conference is the spirit of not only focusing on the problem, but beginning to unite around solutions. And the good news is there are solutions. The good news
This kind of thing has never been done before on a national level. We have some things happening like that locally, but to be part of a national movement, I think a lot of us are excited about that.
This is truly a historic event and an opportunity.
We were inspired by the powerful new ideas we could see unfolding, and it was a great way for those of us at the local level who are often geographically somewhat isolated, share expertise.
It was an opportunity to spend some time together in a little bit different scenario, in a different environment. Yes, we made contacts with lots of other folks and we heard about great work going on, but our Los Angeles delegation really worked together when we came back.
We were so excited. The group of us that were out there, must have been 7 or 8 of us from Chicago, decided that we're going to do this. We're going to come back and support a regional summit. We're going to apply for the funding and we're going to make it happen. Based on the experience that we had in New York, I think those of us who are working on the summit here in Chicago see no end to the possibilities.
People were excited, they were vibrant. They left that meeting feeling like they wanted to continue the dialogue. That kind of enthusiasm is very exciting to us and very gratifying because it was our vision all along to create this vehicle, but you never know until you try whether people are going to be like, oh, drudgery, another conference, or if they're going to be like, wow, this is something new, it's exciting. We're on the precipice of creating something brand new here, which could have really grand results for our movement.